One.
All right, thanks. We are in the Board of County Commissioners Appointed Directors Work Session for April 8th, 2020. My name is Ty Menser. I'm Vice Chair of the Board. And I'm going to chair this meeting even though the chair is online because we are doing this through a Zoom app. And that means that and we are live streaming. So this is not the kind of meeting that we typically would have live streamed, but because of the limitation of the public access because of our buildings, we're making this available to anyone through live streaming. The county manager, Ramiro Chavez, and myself are here in the boardroom, and the other participants are participating through Zoom. They will not be visible to those of you that are watching the live stream. You will be hearing their audio. And so we'll go around and let the record reflect who is present on the audio, and then we can get started. I'll start with the commissioners. Go ahead, Hutch.
Yeah, John Hutchings from.
Do we have Commissioner Edwards online? Robin?
I'm Robin Campbell. Oh, you're looking for Robin Courts.
Yeah, to see if she was able to connect Commissioner Edwards.
Right.
Sounds like not just yet. I'm going to tick through who I see. I think it'll be smoother to do that. I see Shelley Slaughter, Public Health Director. I see Robin Campbell, the Assistant County Manager. I see Josh Cummings, Director of Community Planning and Economic Development. I see Thomasina Cooper, who is the assistant to myself in the Commissioner's office. Robin Courts has a black box, and she is the assistant to executive aide to Commissioner Edwards. Robin, are you there? Robin Courts?
Robin, can you hear us? Was Commissioner Edwards able to join us?
Robin Court's microphone is muted.
Okay, we'll check back. I see Patrick O'Connor, Director of Public Defense. Kurt Harden's login. Kurt, are you there?
I am here. I just don't have a camera that works.
Got it. Do we have Jennifer Walker? Yes, I see Jennifer. Marianne Clear, I see, who is our Director of Pretrial Services. And did I miss anybody who is online?
Dennis Osorio and Maria Ponte.
Okay, great. Dennis Osorio, who is Director of IT, and Maria Aponte, HR.
Hello.
Anybody else that I didn't mention?
Yes, this is Robin Courts, and I have Gary on my phone on conference call.
Commissioner, can you hear us?
I hear him saying yes on my phone, but I don't know if it's coming through on Zoom.
Yeah, we don't hear that. So,
as long as he can hear us and maybe he has any questions, it can be through you, Robin.
Okay, sounds good. Or I may ask him if he wants to just call your phone, Ramiro, and you can put him on speaker.
Yeah, either way.
Thank you.
okay, the two agenda items are COVID-19 response updates and roundtable discussion. We'll start with the response updates, and I will move in no particular order. Let's be mindful of time. This is scheduled for an hour. Obviously, we have several departments, so maybe just a couple, 3 minutes from your department. Let's start with our favorite public health and social services, Ms. Slaughter. Obviously, you kind of leading this whole charge for the county. We really appreciate that. What's your update for today, Shelley?
Sorry to get myself off of mute here. Good morning, everyone, or good afternoon. I don't know what time of day it is anymore these days. So I feel like you have heard me say this a lot. Currently, we have 74 confirmed cases of COVID-19 in Thurston County, 1 death that unfortunately occurred over the weekend. Each day at 3 o'clock, we get an update of more cases. So, and we update that on our website every day. So just remind everyone to check out our website. There's lots of really great information on there. We have been in incident response for 64 days. Half of our staff are over here at the ECC, where I am now, working in close partnership with emergency management. We have about 40 staff that are working on the response, as well as our other essential workers that are continuing to provide public health services in the community. And I think that's my update. We're doing well. We're working really hard, and really appreciate everyone's support of all of us in the community right now.
Ramiro just indicated that Commissioner Edwards has sent in some specific questions for specific directors, and when that comes up, I'll have him ask those questions. Anything for Shelley?
Yeah, I believe Shelley, and this is for Shelley Maria, and maybe the three of us, including myself, can provide an update. Let me read the question. Here would like to know what is the status of the health officer selection process. And I just had a conversation with Debbie Watson. She is doing the background check on the top 3 candidates. And she has had a difficult time to get return phone calls to some of the individuals listed on the reference of those 3 applicants. She has been able to reach out to some, but not to all of them. I did have a conversation with Debbie, and she provided some information that is, I believe it is enough at this point. So I will schedule an executive session on Tuesday morning during agenda setting, and hopefully at the end, for Debbie Watson to provide what she has found so far related to the top 3 candidates on her background check. Do you like to add anything else, Shelley, Maria?
No, I think you covered it well, Ramiro. We're really excited to, and I know Dr. Yu is really anxious for us to get a health officer on board.
Any questions, Commissioner Hutchins, Commissioner Edwards?
No, I just bet Dr. Yu is anxious to get this moving on.
Okay, let's move to Kurt Harden and Emergency Management, who is working hand in hand with Shelley.
Yeah, good afternoon, everybody. I would just add to Shelley's update. We have a number of activities going on here in support of public health. The largest one we have right now is setting up facilities for non-congregate care, which is people who are in isolation and or quarantine and do not have a location where they can conduct isolation or quarantine, having those facilities set up here in the county. We have the capability of doing that now. In fact, some of that has already taken place, but not at the county level. They're taking place at other jurisdictional levels for first responders. Also, there's a number of resources that have stood up in the region for the same type of facilities. And so starting next week, we're going to start talking with counties and other jurisdictions in the region to see if we can do a regional approach, which may be more cost effective when we have situations where individuals cannot isolate or quarantine at home. And just for everybody's information, when we talk about isolation or quarantine, the first step in that process, if somebody is required to isolate or quarantine, we ask them to be able to do that at home. If they can't do it at home for some reason because they have a family member who is in a high risk category, then we ask their agency or their jurisdiction to be able to do that for them. If that agency cannot, then they come to the county, and that's where we start addressing the situation. But we have a number of people in here, as well as what Shelley mentioned. I think that's, we included in that 40 number that you threw out there? Okay, so we have another 15 or so that are in support of that. So a total of 55 here in the ECC. And you've all seen a lot of information about PPE. I will tell you that there are 4 tiers to the State Department of Health PPE distribution process. We have never gotten out of tier 1 yet. We are constant. We can't even fulfill tier 1 at a 50% level. So there's still an acute shortage of PPE within the county, the state, and across the nation. So with that, if anybody has any questions, I can answer those, but that's just a real brief overview of what's happening today.
So just so you know, some of these Zoom meetings, you know, you're sitting at the computer and you can raise hand and stuff like that. Because I'm in this big room, I really can't do that. So you're going to have to kind of just pipe up if you have a question for Kurt. I'll start with Ramiro. Was there anything from?
I didn't see any specific questions for Commissioner Edwards, but I guess if he has anything through Robin, please let us know. And also, if Commissioner Hutchins has any questions for Kurt, please let us know.
Commissioner Edwards is good.
Okay, thank you.
Anybody want to ask Kurt anything?
I do.
Yes, Hutch.
Kurt, what is all the staff down there have been working around the clock and burning the candle at both ends. How is everybody doing physically and emotionally?
So that's a great question. And one of the concerns that we have is how staff are working and handling this. One of the things we're trying to do is we're trying to rotate staff out to give them a day off periodically so that they can, refresh. So we've got a plan in place. In fact, our staffing plan is through April 30th right now. We do have access to additional resources. We brought some Medic One staff over as well to help with some of the processes that are trained in ICS. So, but I will tell you, we also have access to CISD, critical incident stress debriefing, and personnel who are trained in that, and they have access to people. Plus, we also have access to EAP for individuals who may be feeling overwhelmed as well. So we have some support systems in place, and we're trying to work and make sure staff get some time off.
I like the fact you mentioned EAP, but also CISD. That's critical. And the same question for Shelley and your staff. You're muted.
Sorry. Kurt and I are in the same room, so we're trying to make sure that our audio is not drowning out each other. So our staff are doing well. You know, we activated our incident command on February 6th. So we've had a lot of people that have been working many, many days, and especially our operations group that are doing the disease investigation. They work night and day, weekends, and we have activated our medical reserve corps to come in and help. We have pulled non-essential staff into essential positions, and we've had a psychologist available to provide counseling to staff that are burned out. And I've also, at the recommendation of our safety officer, granted some people paid administrative leave in order to help them manage with coping. So, but we're doing well. We're doing as well as we can be. We got a lot of great people, and we feel really supported by everyone. So, including me. So thank you to all who've reached out to me, and it's really, really appreciated. It means a lot to us here.
Yeah, we're in it for the long haul, but thank you.
Okay, let's move to Josh Cummings at CPED.
This is Josh. So yeah, just in terms of we've got most of our team teleworking. There are some of the building inspectors that require us to only go out if there's a life safety inspection. We've greatly increased the e-inspection that we're able to do. So out of this difficult time, there is some positive opportunity, that's for sure.
You're breaking out, Josh. You're breaking out.
Maybe I'll try taking out my video so you can hear me. Is that saved? Can you hear me now?
let's stick with that for now. Let's see how that works.
Is that better? Can you hear me better?
I think so.
Yeah.
So I wanted to say we're doing okay. Most of our team is teleworking. The only ones that aren't are the building inspectors. We prioritize life and safety inspections for them. We are working to streamline our permitting process as we've already started with the project review timeline. We're keeping that engaged and coordinating with the business community and as well as OMB, Olympia Master Builders. And I personally helping to support Jenica Machado, our economic development manager, who's doing a great job staying connected with the community on those efforts as well.
We got a question from Ramiro, or
Yeah, it's a question for Josh. Commissioner Edwards had 2 questions. I believe you addressed the first one, which is how things are going with the streamlining the permitting process. I believe you already addressed that, unless you want to add anything else, Josh. Also, he is interested in begin the conversation about authorizing a third-party review or reviewer in the docket item. But I believe that conversation needs to be further explored and elaborated on April 25th. But if there's any initial thoughts related to this, Josh, I know that you and I had briefly discussed this option. Anything you can add before April 15th?
Yeah, no, our team is working on that. I have communicated with Commissioner Edwards that, as always, community planning and economic development is open to new and innovative ideas. Most helpful would be to have the benchmark information from other similar communities, counties, on how they do this process for externalizing some of the work. Recognizing that part of this is always the public process. And so while we can take some of it and externalize it, we need to figure out what needs to also be done in-house. So yeah, I think it's a further conversation for April 15th. We are looking at it. And if there's benchmarks from other communities, we're open to it, as always.
So just to see if I can verbalize what you just said, just to make sure, since the audio is not there yet. What are you saying that your staff, obviously, as the county is open to look at any other models, I use, that's my word, and you're currently in the process of investigating what other jurisdictions they have as a model to bring a third-party review as part of the document process. But more conversation needs to occur with the board, which will begin on April 15th.
Yes.
Okay. Commissioner Edwards, Robin, do you have any additional questions related to this?
Oh, Gary's good. Thank you.
Okay, and how about you?
any other questions for Josh from the other folks on the call, Commissioner Hutchings or otherwise?
Nope.
Okay, thank you, Josh. Keep up the good work. I'm going to turn to Jennifer Walker, Public Works.
Sorry, it broke up there, so I didn't hear that. Hello. So we have full operations for our water and wastewater. There's been no change for them in this process. We have road operations and traffic operations responding to life and safety issues and dispatching staff for that. There was specifically the solid waste division in our transfer stations. So the Waste and Recovery Center and then the Rainier and Rochester drop box, we are on schedule to open to full operations April 9th, which is this Thursday. And what that specifically means is the self-haul, which had been closed down due to staffing issues. We will be running, accepting self-haul at the WARC beginning Thursday. Those hours of operation are 7 a.m. to 4:45 p.m. So the Waste and Recovery Center is open Monday through Friday, 7 a.m. to 4:45 p.m. They are open on Saturdays and Sundays, 8 a.m. to 4:45 p.m. Rainier and Rochester Dropbox locations will be open starting this Saturday, which is April 11th. Rainier Dropbox Station is open Friday, Saturday, and Sunday, 9 a.m. to 5 p.m. And Rochester is open Tuesdays, Saturdays, and Sundays, 9 a.m. to 5 p.m. So, point of clarification, Rainier will be open Friday, April 10th.
Okay.
Any questions on that?
No, I believe that was one question that Commissioner Edwards had related to how you, the Waste Recovery Center and the satellite locations will be open. So unless, I think that addresses the question, unless Robin, Commissioner Edwards have additional questions related to that item. I have a question for you, but yeah.
Commissioner Edwards, if no additional questions.
Okay. Hey, Jennifer.
I do want to clarify. Oh,
sorry, go ahead.
I just want to clarify that at the Waste and Recovery Center, full operations, but let me clarify two exceptions. The dog park will not be open, nor will the closed loop trail that is on that facility. Neither one of those are planned to be open.
Understood.
They will be closed.
Jennifer, I know that your staff made an incredible effort to open the Waste and Recovery Center this past weekend, Saturday and Sunday. And I know, and I just like to express my appreciation in front of the board and everybody else, because I know based on the shortage of the resources that you have in the staffing levels, I have to applaud you and your staff to open that facility and give at least a little relief to those citizens who want to have a cell hall. So thank you very much, I appreciate it. And if you can tell us the experience over the weekend. I think, I believe early Saturday morning before it opened, it was a line very long, but I think that line dissipated rather quickly.
It did. We had, first and foremost, the staff that have been working have been phenomenal and absolutely displaying the values of the county and of the department. And they've been there for each other and for the community. They've done a fantastic job. And so thank you for acknowledging them. Both Saturday and Sunday, we had lines that were backed up in the queue waiting for operations to open at 8 a.m. We had some of our road operations folks out there helping with traffic control because we had modified the entrance into the facility so that we could queue up down through the recycling area. So we did not have cars backed up on Hogan Bay. And so that was extremely helpful. We had 780 customers on Saturday and approximately 785 on Sunday. A busy Saturday and Sunday, we'd be, really busy, we'd be around 1,000. We're usually, I think, around 500 to 600, I believe, during the week. And this is just for self-haul that I'm speaking of. So it was a steady flow,
I have something.
Go for it.
Number one, Jennifer, are you receiving any feedback from our about 800 utility customers on the extensions and the things we're doing for them?
I have not heard anything specific yet, but I think that's going to be timed with when payments are due. And so when it was passed, I think we had just passed, they're due on the 25th of each month. So I am anticipating we might be hearing more in the near future. But I will definitely keep the board informed when I do.
And to show the extent that this pandemic is having on everybody, this brings out the best in people, but sometimes it's bringing out the worst in people. And I would like to compliment you and what you're doing with the work issues, working around staffing and protecting the employees. It is a tough juggling act, I'm sure, and not everybody has been happy, but we're getting back to some type of a semblance of normalcy. But I want to compliment you yesterday on your poise when we had a discussion on the trails and parks.
Thank you. I don't think now is the time. I do have additional information I do need to add regarding trails, and I'll provide that to the county manager. But I do want to recognize facilities management, Robin's group. They came in the day before we were set to open on Saturday and mounted the splash guards, and that worked really, really well. And so I was very appreciative of that effort.
Yeah, Jennifer, related to the trails, I'm going to bring this item again for further discussion with the board tomorrow morning during agenda, during check-in, which is from 10 to 11:30. So any information you can provide ahead of time, that will be very helpful. And if you have time to join us via Zoom meeting or telephone, that will also be helpful.
That's fantastic. Myself and Carrie Hibden will participate.
Okay, thank you.
All right, let's go to Public Defense, Pat O'Connor.
Okay, well, good afternoon, everyone. If I'm breaking up, I'll just keep talking. So we've been at 7 staff here that have been here in the office for the past several weeks. I'm really proud of our staff, working really diligently to try to do whatever we can do to reduce the trail population. That was priority one. Supreme Court still has a standing emergency order on court process and what hearings are taking place and what hearings are not. We're continuing to suspend all criminal jury trials, which obviously is creating quite a backlog of criminal cases, but we'll continue to wait for further order from the state Supreme Court and our courts once that order is amended. We still have closures to the courts in terms of cases that are pending, that individuals are not in custody. We have a pretty enormous backlog of cases in addition to the cases that are now currently being referred by law enforcement. So we're trying to prepare for that as best as possible. But at some point when we get back to some semblance of normalcy, there'll be a lot of cases coming, new cases coming in the system, and then old cases returning to the system. We continue to have the rest of our staff teleworking. It's going really well. A lot of creativity and ingenuity, I'm sure, as everybody's experiencing, that we have an incredible workforce that, under these circumstances have come up with really creative ways to get the job done. And I'm really proud of our staff for doing that. I have all my attorneys have been going to the jail. I'm going to have to make some decisions on that this week. It's probably not the safest thing for them to be doing, nor is it the safest environment for us to be going into, potentially bringing something into the jail. So I'm working with corrections on that to see what we can come up with, as well as our courts, to try to come up with some more safer ways to get the work done that we need to get done, but also limiting contact as much as we can. We continue to work really diligently on implementing our new case management system. Our teleworking teams are working every other day, seems like, on projects. So that's really great that project's not suspended. Frankly, maybe even ahead of where we would have been had we just been under normal business operations. I think right now it's just, we talked a little bit about this in our directors meeting this morning in terms of planning for when hopefully things start to get better and trying to have a long range approach to, the phases of integration systems wide on when we start to get out of this. It's not going to be, one day we're back to normal, but there's going to be a phased approach and trying as best we can to plan for what that looks like and when that may be. Other than that, everyone's doing well. Everyone's healthy as far as I know. I don't know of anybody in my department that is symptomatic, and hopefully we can make it through without anybody getting sick.
All right, we got a
That's
question.
really
Thank you, Pat. Got a question from Romero.
Yeah, this is from Commissioner Edwards to you, Patrick. If you
Right.
can, and I don't know if you can actually answer overall this, but I'm sure you have a pretty good grasp in terms of the process, some of the strategies you and your partners in the law and justice have implemented to lower the risk of inmates at the jail, and also to help reduce this jail population.
Yeah, thanks. And Commissioner Edwards, if you can hear me, Robin passed on your question earlier. So we have worked really, really hard over the past month to decrease our jail population. I think we've decreased it somewhere around 30%. I think we're at this point, as of today, we may be in some form of stasis in terms of who's in the jail. Law enforcement's done an amazing job in prioritizing who's being arrested. So we're seeing less people being arrested on minor offenses and taken into custody, which has tremendously helped our situation. Our public defenders have worked really hard in approaching the prosecuting attorneys on presenting agreed orders to get folks released or converted to electronic home monitoring so they can get physically out of the jail. I think we might have reached the point in which everybody that would either be agreed to by the prosecutor or the court would allow that option. We may be seeing the end of those. We'll continue to try to ask for those. Obviously, that's our job, but we may not get as many agreements or the court releasing individuals as we'd like, but we'll continue to do that. I think right now, I think your question was in regards to the work release facility. Obviously, that is suspended, so no longer are folks going into the community coming back to that facility, which makes a ton of sense. We have about 19 folks there. We've really done a great job on the dorms in the jail, which frankly is sort of the worst case scenario for an outbreak in the jail because they're open spaces with up to 80 individuals in there. We've gotten those numbers way down, so that's a good thing, but that's still obviously a risk. One of the challenges that will remain is in the isolation pods in the jail as criminal trials are suspended. So those cases aren't going to see a trial probably, frankly, for the next handful of weeks. I don't see us being in a position to invite, 100 citizens to come serve on jury duties anytime soon. So that's an area we've all recognized. We got to see if we can make some improvements there on keeping those numbers at a safe number.
Is there any additional questions to Patrick's report, Robin? Oh, Commissioner Edwards?
I have something, this is Shelley. I have something that I would like to say about Pat.
Go for it, Shelley.
We submitted that lead grant to the Healthcare Authority several months ago and received word that they are interested in funding our proposal to the tune of 1.4 million or more. But there are some additional conditions that we have to meet to comply with the requirements of the technical assistance group and the funder. And I just want to say thanks so much to Patrick because he helped to coordinate and lead the conversation that we needed to have with our law enforcement partners and all of our other partners to decide, whether we could go forward in having conversations with the funder about it, and really was a big help in crafting that proposal and now helping to facilitate moving forward. Since I was so busy, I was like, I know who could do it. And so I really am grateful for you for doing that, Pat. And I think it's a really exciting opportunity for our county and community if we can make it happen.
Yeah, you bet. Yeah, thanks, Shelley. Yeah, we're real excited about the opportunity. It's just that at this point, it's an opportunity. We have a meeting scheduled sometime tentatively next week with the funders to work through some of the issues that they identified in our proposals, and I'm confident that we'll be able to hopefully work together and get this opportunity for Thurston County. It's a golden opportunity. Really excited, and thanks to Shelley and Mary Ann O'Gara with her office on getting us this opportunity, frankly.
Hey, Pat, this is Hutch. And you answered one of the questions I had, but Gary already asked it up front. That's good about the jail reduction. Thank you. But I want to thank you also for the recommendation of the movie Just Mercy, that true story. And it's a great movie. And one of the best lines I took from that was, hopelessness is the enemy of justice. I thought that was a pretty poignant part of the movie. Yeah. So thank you for the recommendation.
You bet. You bet.
Thanks, Pat. And I want to echo the thanks on the lead. You and I had a meeting with John Thunheim, so I kind of got a preview of that and already thanked you and showed my excitement. But yeah, it's going to be really good. I mean, my takeaway was that the state was basically looking at certain pieces of what we did and saying, we want you to amp this up and we'll fund it. And they were things that we were kind of holding back on because of resources, but it's kind of a win-win for us to be able to develop even a stronger program and then potentially get the money to implement it.
Yeah, absolutely. We've got some things to work on, but I think we're all really excited that there's interest in supporting our county and in some criminal justice reform and being able to financially back it. So it's exciting.
Mary Ann, I'm going to go to you. Pretrial service. Mary Ann, can you hear me, or can you? Can't see the board up there. She looks unmuted.
Can you hear me now?
Yes, can hear you now.
Okay. I had to take my laptop off the docking station for some reason to get my speaker to work. But lesson learned.
All right.
I'm happy to report that my department is fully operational as telecommuting. So I am the only one coming into the office on some days. About mid-March, I think, was when I pulled my team out of the jail so that we weren't coming into the jail to do interviews. We're doing them telephonically. There was a couple-week period, maybe a week and a half, where we weren't doing interviews at all while we coordinated how to best accomplish them. And we are interviewing most defendants. There are times where there are specific safety concerns for one reason or another that we don't conduct interviews, but we are interviewing most individuals as they come into the jail. We're still providing full supervision for a little over 450 individuals that are pending felony cases in the community. And we are able to do that with cell phones. So all of my team has their work phones and they're able to work at home. And they're communicating with each other and supporting each other because of various technical capabilities. Some have access to other programs because of what they have access to with the criminal justice information. So they reach out and work together very well. So I'm very proud of my team for how they're working. They're all healthy at this point in time, but they have concerns about their family members. And so they're supporting each other through that. We've been coordinating with our criminal justice partners. We've been working very closely with the jail at this point in time, changing how we're operating, working with Dennis and his team, because we've been very needy up front with our technical needs as we changed working from in the office and at the county to all working at home. But I think that we've kind of hit the smooth spot where we're smoothly operating. So I'm going to knock on wood for that. Working with Patrick's office, Superior Court, everything's been going well. Again, I hesitate to knock on wood as best as it can for where we're at. But despite all of the arrests going down and the jail population going down, I did want to point out that our March screening reports that we did was only about 15 fewer this March than it was last March. So I wanted to note that, and I think April should be fewer because there's a lot fewer arrests coming into the jail. But for March, there wasn't a significant difference.
Anything for Marianne? Okay, thank you, Marianne.
Yeah, I do.
Yeah,
I couldn't hit mute. I couldn't hit unmute fast enough.
No, sorry.
Hey, Marianne, with all the changes and significant impacts that the pandemic's had on your office, are there any byproducts, anything positive that's coming out of it?
There's a lot positive that's coming out of it. We have been, actually, Patrick and I were talking about this. We were looking at our Advancing Pretrial Policy and Research project, and a lot of the efforts that we've been implementing now, they appear to be some of the pretrial reform and some of the systemic improvements that we were talking about making over the 5-year project that we've been implementing now. And so I talked with the technical assistant provider, and she was going to get with the researchers, and she's talking with some of our stakeholders individually about data and having them provide some data analysis for us. And so I'm looking forward to more to come on that. We haven't convened as a research project yet because we've been actually doing the work and handling how to address our operations now. But when we come back together as a group, we're going to put together our data and look at the results and the impact of what we're doing now.
Beautiful. Thank you.
Okay, Dennis, let's go to IT.
Sure. Good afternoon. The first couple of weeks, obviously, we had a big spike in getting everybody teleworking. So, but currently, we just have minimal staff here at the campus, just in case anybody actually on site has hardware failures and whatnot, and everyone else is supporting the county remotely. From that perspective, I think we're doing well. I've really focused on communicating both over, with our peers and with our customers to try to keep all communication lines open. And then we're still trying to work with, as this got extended, work with the courts and work with other people, other offices and departments to see what their business needs are and what we could implement to make sure everyone's operational. It's kind of a balancing act here as we're trying to keep everybody operational, but not implement something that's going to put the county at risk. Some of you have seen some of the emails I've sent out about phishing and some of the Zoom technologies. Obviously, people are using these to exploit them and cause damage to certain organizations. So we just need to stay vigilant with that and try to find that balance to keep everybody operational, give them the best technology we can, and minimize the risk at the same time. But other than that, none of my staff have any symptoms that I know of, and everybody's chugging along.
All right. Questions for Dennis? We had some Zoom bombers at TRPC last week. So that was sort of comical, but yeah. But I heard that Zoom is working on security upgrades.
They added a password now for every meeting, so that's a little bit added security, I believe.
Okay. Anybody else?
That would be my question.
Yeah.
Thank you.
They are working diligently on that. I know that I've seen a lot of updates coming out. Obviously, they had a huge spike in market share literally overnight, and then all of their vulnerabilities then get exploited immediately. So look like they're trying to fix those as quick as they can, and it is a slick product. So
good. Thank you, Dennis. Maria, HR.
All right. Myself and staff have been really busy getting up to speed with the Families First Coronavirus Response Act, the 2 new leave benefits that employees are now entitled to, creating policy around that, as well as application form. We have gotten more inquiries about the child care component of the leave laws, and a few about the medical piece of it with either self-quarantining or isolation or COVID symptoms. That work has created a need to create new code for payroll. So payroll staff has been really busy trying to define between the different pay codes, either for paid administrative leave, work on COVID, hazard pay, things like that. So they've done a tremendous job of expediting those needs. On the training front, we are preparing to offer online training for sexual harassment for new employees as well as refreshers. We're doing a beta test internally in HR, and once that's good to go, we'll issue a countywide email encouraging people that are teleworking to take advantage of that and accomplish that training from home. Anyone on the VPN can actually access the LMS. What else? Oh, good news. The other day, there was an inquiry about if we had any more collective bargaining agreements to settle, and we got the juvenile detention settled. So that was the last one, and they agreed to a 3-year contract.
Any questions for Maria?
Just one, not a question so much as thank you for that update on the bargaining units. They're the ones I asked about, how many were still outstanding. Right. But also, you've had so many different curveballs thrown at you from various legislation coming down as a result of this pandemic, and you're working diligently, but also navigating through this maze quite effectively. And I want to thank you very much, because it's not over yet.
No, I have a new mantra, and it's win. What's important now, and it changes from hour to hour.
Yeah.
And so just pivot, move on to the next thing, recognizing I'll probably look back and see some things that could have done better, but we're all trying really hard, and the staff is doing a great job working remotely. They're responsive, and I feel that any questions, emails are being responded to very quickly. And I appreciate all your patience if it's not.
No one is getting out of this without having them touch them in very, very impactful ways. And I have complete confidence in not only you, but all of our directors. What a great bunch of leaders we have. Thank you all very much.
Okay, with that, I'm sorry, I think we've got the departments covered. I'm going to ask the county manager for any updates he wants to give.
No, I think all of you cover just about everything related to the county. We continue to have, I believe, staff asking the questions on related to what, cloth masking is required by on the day-to-day basis. We had a initial conversation this morning with the directors. Hopefully we can send an email this afternoon providing some guidance related to face cloth maskings. And that's pretty much where we are. We'll continue to look at the impacts of the budget. We had initial numbers as to the last pay period. Just to give a perspective, our payroll in the last pay period is just about $5.2 million. So the paid administrative leave cost $144,000, which is just about 2.7% of that, I believe. And also the hazard pay in the last pay period was about $15,000. Considering the pay period did not include all that of that period. So the $15,000 is not encompassing the whole pay period. So we'll see in the next pay period how that is going to materialize. If I was probably to look forward to, a hazard pay will cost the county probably $60,000 if we go all the way to May 4th. Also, we're tracking on how much expenditures we do related to the response to the COVID-19 related to stray salaries. And that is something that we need to keep track for a potential reimbursement. And that is just about in the last pay period, $220,000. So those are the numbers that I wanted to report. Jennifer
Walker.
I would just jump in.
Oh, Robin.
I was going to go to you next, Robin, so go ahead.
Sure. Just to update what Romero reported on hazard pay, I anticipate that being more like 90,000.
Okay, there you go.
Yeah, a little higher. Yeah.
For the whole period, you mean from the point?
From the date that it was approved, March 25th through May 4th.
Got it.
If it continues as it was in the 7 days that we have, it's going to be around 90,000. And that's all general fund.
Wow, I was optimistic.
Yes, you were. Unless I was missing something, and I could have been. It could always be higher. So we are working hard on the budget, and we are just in the very early stages when it comes to being able to assess the economic impact and how that will affect the county budget. But budget staff are working very hard to find indicators that we can use to actually convert to numbers. We're working on ranges of impact right now. The central service staff are working hard to support all of you. And then I'd also report that we have formed a finance team that is reviewing all money that might be available to the county, all of the bills that are getting passed at the federal and state level. And if any of you become aware of bills or grants, please loop us in. And then we are also developing guidance on how to track and document. So that'll be coming out soon.
Jennifer, you had a hand up for for maybe Romero, but go ahead and ask your question.
Yes, so I have two questions. The first, I just wanted Romero to run through those numbers real quick, and I missed the first part of it. I know Robin said the hazard pay, she's anticipating at 90,000, and then it was 220,000 for other related expenses, but I missed the first numbers.
You talked about administrative leave.
The administrative leave is 144,000. That was on the last pay period. But the last pay period started on March 16th, which at that point we didn't have administrative leave implemented quite yet. So also the hazard pay was $15,000, and it was just a portion of the last pay period that I'm reporting. So on the next one, we'll see a full spectrum of that. Yeah.
Okay, and then Robin, who is on the committee that you were referring to that you said let us know? Who's us?
Finance Oversight Committee is me, Diana Benson, Joe Wolf, Brandon Weber,
Joy Miller.
Yep, Joy Miller, Corinne, her last name Marson, then Marcia Boyle, Kurt Harden, and I am probably Kathy Goulet. And I mentioned this morning that we might want someone from HR, and Maria, we are making that request so that someone's not having to run back and forth and be a liaison, and we're not duplicating efforts.
Thank you.
Thank you.
I have something to add. This morning, I know Ty was and Romero, and I sat in on a White House briefing on the COVID update. And this is regarding, towards the end of that conversation, I missed it because of transmission, but one of the secretaries that was presenting said if your organization, your county, has received a burn grant last year or the year before or in the past, I'm not sure how it was worded, that we're pretty much going to be able to get, I went away, here we go, get another funding for this pandemic. And I don't know if you have the specifics on that, either Ty or Gary, or Ty or Romero.
I have that.
Yeah.
Oh, do you?
That's the DOJ grant. Yeah.
Right.
Okay.
We're going to get not quite $80,000 for law enforcement response.
Yeah. We're working on that, Commissioner.
Okay, go. Thank you.
Okay, well, we're almost done, but I wanted to give the commissioners, Commissioner Edwards may have trouble reporting given his game of telephone here, but Commissioner Hutchings, did you want to report to the directors on anything from our board perspective?
I just want to say that I had a conversation with Romero in my office yesterday, or the day before. It might have been yesterday. It might have been last year for all I know now. And it was about manifest destiny and why and how we are all here in this position, in these roles at this point in time in our lives. And I can't think, like I said earlier, a better qualified and more compassionate and caring and smarter group of people, men and women, that are going to help see us through this this nasty, once in a lifetime type event. So thank you all very, very much for all you're putting in. It's got to be exhausting. I know it's challenging. Thank you.
I'd just like to say on Friday, I had the pleasure to be at the ECC. There was kind of an all hands on deck meeting from noon to 1 with Dr. Yu giving some, and then some of the team leads giving a report out on what they're doing, and just to be part of that and see what everybody's doing. I'm in awe of the work that our emergency directors from Kurt and Shelley, Dr. Yu, all the way down the line. They are just now getting some staff relief and cycling through, as Kurt mentioned, which I think will be really important. Nobody knew when this started how long it was going to last, so nobody quite knew how to structure the cycling through of staffing. So now we sort of realize that I think we're doing great, but we're realizing that it's going to be longer than we thought at the beginning. So I think everybody's making the appropriate adjustments to their planning and thinking. I like hearing a lot of the directors talking about the medium and long term. I think there's so much there's so many silver linings down the road from this, things we can learn, things we can figure out that we could do better, and create more efficiencies, and whether it's e-inspections at CPED or the effect that telecommuting is having on somebody said they haven't filled their gas tank in a month, and that is, I think we're seeing some environmental repercussions from this shutdown that I think can be lessons learned, all sorts of things. So I really encourage you to think about the future and how we'll phase this back in and be better and stronger and more efficient than ever. So with that, does anybody have a closing word? We're at the end of our hour.
Robin,
yes.
Courts may have something.
Robin, anything from Commissioner Edwards to communicate?
I think she's getting feedback.
Stand by.
Okay, great.
Okay, Commissioner Edwards wants to express his thanks and says, what a great thing this will be to add to your resume down the road. All this experience you're getting.
All right, guys, I look forward to seeing you in flesh and blood as soon as it's safe and possible.
And have lunch.
Yeah, we can eat. Thank you. We're adjourned.
Thank you.
Thank you all.
Bye, you guys.